Thank you, Dr. Reddy's, for organizing such educational activities. I'm happy to participate. So, as you all are aware, the COVID pandemic, especially the second wave, had hit us all hard. We have all gone through turbulent times, whether in our own families or our neighbors. Everyone has been touched during this second wave. And kidney health, especially, I would be focusing how that got affected during the COVID and due to COVID, and what we can do during and after the post-COVID effects of on the kidneys. So before going into the effects, I would briefly discuss about what are the kidneys. As you all know, they are the filtering organs in our body, which are bean shaped. We have two in number, and most of the what I tell my patients typically is they like you have a municipality truck coming to your colony to carry out all the garbage that has been accumulated throughout the day. If the truck doesn't come regularly, what will happen is there will be accumulation of all this garbage, and there will be diseases like dengue, malaria, everything. All such communicable diseases will spread. There will be nuisance and bad odor, everything of those effects we can observe. Same way, if the kidneys, which are doing this tireless job of filtering out all the toxins in our body, if they start functioning less, there will be accumulation of toxins in the blood. Like if one day the truck doesn't come, we can tolerate. But if for a long time, if it is not coming, then it becomes unbearable. In the same way, when the kidney function is slightly affected, some toxin levels are high, patients don't realize the symptoms. But eventually, as the kidney function goes down, that has impact on all other organs. So kidneys are not just the waste removing things also. They have a lot of other functions like controlling the blood pressure. The salt and water excretion that the kidneys do, if they are unable to do that properly, there will be salt and water accumulation leading to rise in blood pressure. They will also manage producing a hormone called erythropoietin, which will stimulate the bone marrow to produce blood. So our blood production also depends on kidneys. Our bones, the kidneys are the organs which activate vitamin D. The vitamin D that we get from the sunlight, it needs activation in the body, which happens in liver and finally in the kidney. If that is not happening, our bones start to become weak. The blood calcium levels start to decrease. So kidneys are not just filtering organs, they have a lot of other functions as maintaining the acid-base balance, maintaining the electrolyte balance, maintaining the water balance, blood pressure. So how do these kidneys work? Kidneys have 10 lakh filters in them, almost like 1 million filters in each kidney. And there is an inlet which brings the blood inside the filter, and there is an outlet. That is, this whole structure is called a nephron, one unit where the filtration happens, and such 10 lakh filtering units will eventually drop by drop form urine and excrete all the toxins and water. And if the kidneys are not functioning properly, that's when all these balances that the kidney was maintaining, whether it's the water balance, patients start to get swelling in the legs because the water accumulation. Swelling is visible from outside, but when water accumulates in the lungs, the air spaces, then breathlessness starts to come, and electrolyte imbalance, toxin accumulation related symptoms will start, and eventually patient will need either dialysis or replacing a new kidney, that is doing a kidney transplant. So how common are the kidney diseases in India? So you will be surprised. Even I was surprised when I first came across these statistics. It is said that almost 17% of Indian adult population has some form of kidney disease. In US, they say around 15% of their adult population has kidney disease. This chronic kidney disease, the problem is lack of awareness. There was a study published in Lancet which looked at awareness of kidney disease amongst those who are having kidney disease. So when they looked worldwide, it was found that only 7% of kidney disease patients are knowing that they have a kidney disease. 93% of people who have a kidney disease are unaware that they have a kidney disease. So 50% of these kidney diseases are diagnosed in very late stage, especially when they start getting symptoms and requiring dialysis. That is the point when 50% of them are diagnosed. So how to know whether we have a kidney disease early? What are the symptoms of having a kidney disease? The kidney disease in the early stages doesn't give any symptoms. So it is mainly picked up with blood test called creatinine level and urine test called urine microalbumin to creatinine ratio. So these are the two tests which can detect kidney disease in the earliest. When the symptoms begin to come, what are the symptoms? Patients start noticing swelling in their legs or shortness of breath when they are walking. They may feel nausea, lack of appetite, their sleep pattern will change, they may start getting swelling on the face and itching over the body. These are all the uremic symptoms which come quite late, and when such symptoms are there, it is fairly advanced kidney disease. So what I would suggest is, we should not wait for these symptoms to come. Those who are at risk, so those who are at risk of developing kidney disease, they should at least once in a year do a kidney health checkup, that is blood creatinine level and urine microalbumin to creatinine ratio. So who are these people who are at risk of kidney disease? Especially diabetics. 30% of diabetics in some stage of their life are likely to get involvement of kidney because of diabetes. Second important risk factor is high blood pressure. Now, high blood pressure is the simplest risk factor which can be easily managed and prevents cardiac events, that is heart attacks, strokes and kidney disease if well managed. But surprisingly, only 35% of high blood pressure people are really well controlled. 65% are not well controlled. So, because again, symptoms are not there. Many of you, of the patients don't get any symptoms. So they remain unaware of their blood pressure control. People at times tell that my blood pressure is usually 150, my blood pressure is usually 160. I don't get any problem with it. The problem is, we don't get any problem, but the organs are suffering. Like when we are watering a plant, if we water it with a high pressure, it will expose the roots. In the same way, the pressure in our blood vessels, the higher the pressure, this blood is entering into all of our target organs like the brain, the retina, the kidneys. And when it enters into these organs with higher pressure, it will affect the filters. Like in the kidneys, there are 10 lakh filters in such a small organ. So you can imagine how minute these filters must be, how delicate these filters must be, and the greater the pressure, the more the damage to the filters. So the other risk factors for kidney disease, apart from diabetes and hypertension, are smoking, obesity, having a heart problem or a liver disease. Any other organ disorders will also affect kidneys health. So protecting ourselves from obesity, diabetes and hypertension, these are the most important things. Sometimes kidney disease comes as an inherited problem from family, which runs in families. So these are the people who should screen themselves at least once in a year. Now, what are the types of kidney disease? So primarily, kidney disease can be acute or chronic. Chronic means something that is there for a long time. So when the kidney disease persists for more than 3 months, it doesn't recover within 3 months. We call it a chronic kidney disease. Other types of kidney issues that we come across are formation of stones in the kidney, infections in the kidney, problem with the filters of the kidney, some inherited disorders like familial disorders like cystic kidney disease. And kidney disease we classify into 5 stages. So stage 1 is when the kidney function is 90%. When we call it GFR, or the kidney's filtration rate. But to make it a little simple to understand, when the kidney function is 90% or above, we call it stage 1. When there is protein leak in the urine or other issues, but the function is still 90%. That is stage 1. Stage 2 is when the function has come to 90 to 60%. Stage 3 is when the function has gone from 60% to 30%, and 30% to 15%, it is stage 4, and below 15% when the function goes, that is stage 5 or advanced kidney disease, where we start discussing about dialysis and transplant. So it is a challenge to pick up the kidney disease in the earliest stage, stage 1 and 2, because most of these people will not have symptoms. And these are the stages when if we intervene and do the necessary changes, we can postpone the progression to dialysis by 10 to 20 years if we intervene in stage 1. Whereas once the symptoms start to come, which happens in stage 4 or stage 5, at that point of time, even if we do a lot of things, we can hardly postpone dialysis by few years. So picking up in the earliest stage is of paramount importance. So what are the complications of kidney disease? Now, as we already discussed the functions of kidney, when all these functions are not happening, like the kidney is involved in producing blood, so kidney patients develop anemia, their blood levels start to drop. Their bone health is dependent on kidneys, and if the bones are getting affected, there is risk of bone pains and fractures. Patients may have uncontrolled blood pressure, heart attack, even when the kidney function is still good. When the urine protein leak starts to go up, that itself indicates that the blood vessels are getting affected, and kidney disease patients are at high risk of getting heart attacks. When the electrolytes are not being managed by the kidney properly, the blood potassium levels may go up, that may cause heart rhythm abnormalities, blood phosphorus levels may go up, and it may also affect a person's fertility and sexual drive. It may also, kidney disease is a marker of our immune function also, and when somebody gets affected with kidney disease, their immunity comes down and they are at risk of infections like urine infection and lung infection. So all these complications set in once the kidney disease progresses ahead. So diagnosing kidney disease, most of it is based on the blood and urine test. The blood test is serum creatinine, from which we estimate the kidney's filtration rate called GFR. And based on that, we classify the kidney disease into different stages. Whereas there are other imaging techniques like ultrasound, CT scan, which can detect the structural abnormalities in the kidney. If there are any stones in the kidney, if there are by birth some people may have a single kidney, some people may have abnormal pathways in the kidney, the ureter, there are duplication of it. So there are different variations, anatomical, those can be detected by doing an ultrasound or a CT scan. Whereas certain diseases, that is the kidney filter disorders, they need further advanced investigations like the kidney biopsy. So kidney biopsy is not for cancer of kidney. Biopsy, many times people understand it as like done for cancer, but kidney, if function starts to deteriorate fast and we are not finding the exact cause, then to find out the cause of kidney failure, we may do a biopsy which picks up certain few filters from the kidney, and we analyze the cause looking at those filters under microscope. So these are some tests which can tell us about kidney disease and why the kidney disease has occurred. How do we treat kidney disease? The most important thing is controlling diabetes, controlling blood pressure, controlling obesity, reducing the protein leak in the filters using appropriate medicines, and on top of all these, giving the chance to the body to heal itself by doing proper lifestyle changes and dietary changes. So diet plays a paramount importance in kidney disease. Like what I typically tell my patients, if you have 10 servants in your house, and if 5 of them go on leave, do you organize a party in your house? No. You have hardly 5 servants left. If you start doing parties in your house, those 5 servants will also get overworked and stressed, and they would also want to leave early. So the toxins that are being produced in our body, if the kidneys filters are functioning less, the toxin production has to be addressed. We should eat things which will produce less toxins, less salt, less water intake, so that there is no swelling. So if the number of functioning filters are less, the workload should be less. So the diet has to be appropriately changed. The lifestyle interventions like daily walk, some exercise every day, preventing obesity, doing yoga and certain pranayam like the Anulom Vilom pranayam, which can reduce stress in the body and improve sleep quality. All these are essential to control the progression of kidney disease. And never miss on your appointments for timely regular checkups for your blood pressure control, for your sugar control, for your protein leak, how effectively the protein leak has been reduced. All these parameters should be well targeted. The HbA1c, the sugar control, HbA1c we should target at 7, at least below 7.5. Blood pressure target of 130/80 or below. And urine protein leak should be reduced to as less as possible with appropriate medicines, and we should ensure every 3 monthly that these targets are being achieved and maintained. That is how we manage, retard the progression of kidney disease. We prevent kidney disease progressing to needing dialysis. But once the kidney disease has reached to the stage of requiring dialysis, that is the time when we should prepare them for fistula creation, for dialysis or transplant. And these are the two options for those with advanced kidney disease. And one very important thing that I missed: avoid over-the-counter taking medicines without the guidance of a proper physician or nephrologist. Especially painkillers should be avoided, and there are certain vaccines which are very essential for those with kidney disease to prevent dangerous infections like pneumonia. So those vaccines should be given in time so that such deadly infections should not cause a fast deterioration in kidney function. And yoga for kidney health, very important. There are different yogasanas and pranayams which will help improve the kidney's health. And you under the supervision of a proper trainer, we should perform these asanas and the pranayam to achieve the maximum benefit of all the medication that we are on. So especially I would recommend the Setu Bandhasan, Ardha Matsyendrasan and Anulom Vilom pranayam. These are very good for kidneys. So much of this we have discussed. Yeah. So coming to the COVID part of kidney disease. Now, COVID, we all feel is a disease of the lungs. And yes, it has caused life-threatening oxygen deficiencies, and people have lost lives because of getting their lungs affected. But COVID doesn't only affect lungs. It affects multiple other organs in the body, and kidneys are not an exception. What has been observed in last 2 seasons of this COVID pneumonia, the recent studies that have been published from US and as well as from Indian hospitalized patients, there was a study recently came out which studied around more than 3,500 patients who were hospitalized due to COVID pneumonia. It was found that 46% of COVID hospitalized patients had developed acute kidney injury, which means a rise in creatinine from its baseline. That's a big number. Our ICUs also, when we saw especially ICU patients, almost everyone had some or other degree of kidney involvement. And it was seen 20% of these ICU admissions needed dialysis. 50% of them did not recover. Now, at discharge, it was seen that 36% of these COVID pneumonia patients who developed AKI or acute kidney injury, 36% of them did not reach to their baseline kidney function at discharge. What does this mean? This means there is a significant number of people who were treated and who recovered from COVID pneumonia, but they are having a compromised kidney function. It may improve or it may not improve. That needs to be followed up. At least 1 month after the discharge, it is essential to look at the blood creatinine level and urine microalbumin to creatinine ratio to understand whether the kidney function has fully recovered or not. If it has not recovered, necessary changes with the help of your physician or nephrologist should be done in your medication and lifestyle to prevent the progression of kidney disease. This 17% of adults having kidney disease in Indian population, most of it was due to diabetes and hypertension, almost 50%. But now the third entity, which would be the post-COVID acute kidney injury related CKD. So I would recommend anyone who is hearing, if anyone in your family had significant COVID pneumonia requiring hospitalization, it is worth checking their serum creatinine and urine microalbumin to creatinine ratio at least once in a month for next few months to understand that there was no significant injury to the kidneys and the kidneys are at their best health. With this, I would like to conclude today's talk, and I am there for taking any questions. Thank you.
So we had one question from Mr. Chandan. So many people are having diabetes. What precautions do you suggest to take care of the diabetic, keep their kidneys healthy?
Almost 15% of Indian adults above the age of 20 have diabetes, and above the age of 50, almost 30% of them have diabetes. It's a big number. And diabetes is a disorder because of diet and lifestyle. And the most important thing to prevent diabetes or to keep the diabetes under control or prevent diabetes related complications, the most important two things are dietary changes, low carbohydrate diet, and having good physical activity to improve insulin sensitivity of our muscles. So exercise and dietary carbohydrate restriction, these are the two most important things for good sugar control. Now, even after having done that, the sugar, if it is high, what I typically tell my patients, if you cut an apple and keep it open, what will happen? The white surface will turn red and it will turn black. Why that happens? That happens because it is now exposed to the oxygen in the air, which causes an oxidation reaction. In the same way, the glucose in our blood, it affects almost every protein that it comes in contact with, whether it's the proteins of the kidneys filters, proteins of the blood vessel lining, whether proteins in the retina of our eye. So all these, the heart, the brain, the kidneys are getting, the proteins are getting denatured or glycosylation reaction. Glucose does a reaction with all these protein and produces advanced glycation end products. That is, it is just like for you to imagine, like the oxygen in the air causes oxidation reaction of the apple, in the same way glucose in the blood causes glycosylation reaction to our all these important organs. And so eventually diabetics will develop kidney disease, 30% of them, because of poor sugar control. So with diet and exercise, it is important not to neglect to observe your blood sugar levels at frequent intervals, monitor your sugar levels, and if diet and lifestyle is unable to control it, go for appropriate medication and keep a close watch on your sugar levels. That is how you can prevent the advanced organ involvement from diabetes.
Sir, we had one more question from Mr. Rijwan. So what diet plan you will recommend for diabetic pre-CKD patients?
Stage 3 patients. Okay.
Yes.
So diabetic patients, what I typically tell them, see, for blood sugar control, you should put less sugar in your body, because your body is telling that I am unable to handle sugar. It is staying in the blood. So where is this sugar coming from? People may say, I don't take sugar in my tea or coffee, I don't take sugar. But there is a hidden sugar. Hidden sugar is all the processed foods, the biscuits, the breads, the maida, whatever products made from maida. The maida is the refined carbohydrate with high glycemic index, and it is just like taking sugar. Even whole wheat, 80% of the grains weight is carbohydrate. Only thing is, when you have lot of fiber with it, when it's a whole grain, the glycemic index will be less. So you need to understand two things of any food item. What is the glucose load and what is the glycemic index? Glucose load means how much glucose is there in that food stuff. Glycemic index means how fast that glucose is entering into your bloodstream. The simpler the glucose, the faster it will enter into your blood. So the faster it enters into your blood, it overwhelms your body's capacity to handle it. If your body gets enough time, if the glucose is getting released slowly into your blood, your body gets enough time to handle it. But if the glucose is entering fast, that is, if you take simple sugars or refined carbohydrates like maida, that has high glycemic index, which means it will enter fast into your bloodstream. It will overwhelm your body's capacity to produce enough insulin to handle it, and it will damage your system. So first and foremost thing is you look at what food you are eating. Sometimes people will say, is Marie biscuit okay, this biscuit okay? So all bakery products, I would say better to avoid anything that is manufactured and packaged. Better to eat whole grain, and most of it should be vegetable based food, home cooked. So vegetables are, what should be the proportion of vegetable to grain? I would say 70 is to 30. If you are taking 1 cup of rice, you take 3 cups of vegetables. If you eat that good quantity of fiber along with that rice bowl, or 1 chapati you can eat, you take at least 2 cups of good curry or sabzi. And the second thing for kidney disease, once now diabetes, we are reducing the carbohydrate in the diet. Once the kidney disease has set in, now the urea that is produced in our body, the urea creatinine are byproducts of the muscle and the protein intake that we do. So higher the protein intake, the more the urea and creatinine production, or more the toxin production in the body. If our kidneys function has gone below 60%, that is stage 3 kidney disease, 60 to 30%. That is like our house which was having 10 servants, now we are managing with 5 servants. So if we want to keep these 5 servants working for us, we need to reduce the workload on these 5 servants. And otherwise, if we keep the same workload on them, these 5 will be also exhausted soon and will start to run away. So important thing is reducing, especially red meat. Non-veg can be taken occasionally, but it should not be your predominant diet. Vegetarian protein, how much protein we should be taking is 0.8 gram per kilogram of ideal body weight. So your dietitian can help you understand, but the simple formula I would say is, if you don't restrict any vegetarian protein like dals, and if you are cutting down on your non-veg, you would be coming to a normal protein diet. Now, those who are in an advanced kidney disease stage and want to further reduce the progression towards dialysis, people might need very low protein diet where they cut down on the vegetarian protein intake as well. But that puts them at a risk of getting infections, because their immune system will be affected because of very low protein, as well as the muscle strength may come down. So if we want to reduce protein intake so that we can postpone dialysis, at the same time we don't want protein energy malnutrition, there are certain options called keto analogs. So these keto analogs are like there is no nitrogen in those amino acids, and these can help you maintain your protein levels, at the same time not add to the urea burden, and preserve the kidney function for some more time. So these could be some strategies in diet which could help diabetic CKD patients. Another important thing is about the potassium. CKD patients may have a high potassium in their blood. So we generally typically tell those with high potassium in the blood to avoid coconut water, bananas, and fruits which are very high in potassium. And there are certain fruits which are low in potassium, which we ask them they can eat regularly, like apple, papaya, pear, guava. These fruits are relatively less in potassium and can be eaten. The dry fruits are high in potassium. Coconut water and bananas are high in potassium. They should be preferably avoided in advanced kidney disease, especially if their potassium level is high.
Sir, we had one question from Ibrar Ahmad. Sri Radhe sir, very nice and happy to see you. Sir, suggest the need of oral nutrition supplement for CKD as well as normal person doing workouts.
So Vikrajji, after a long time, it's nice to hear from you. So oral nutrition supplements for CKD patients and normal people doing workouts. See, those with normal kidney function doing workouts, I would recommend be as natural as possible. Avoid as much as possible supplements, especially coming from there are in market lot of unauthorized supplements which might be containing androgens and steroids, and to give quick results to people with doing workouts. You need to choose cautiously from such things. Better is to restrict to good natural food. So if somebody is doing heavy physical muscle building kind of workout, I would say your protein requirement may go up from normal individual's protein requirement of 0.0 gram per kilogram to 1.2 or 1.5 gram per kilogram per day. Sometimes people take huge amounts of proteins like 2 gram per kilogram and more, and we at times come across people with rise in their creatinine with too heavy protein intake. So I would say it should be done under supervision, under guidance of a proper trainer and dietitian. And it's wise to once a while check your creatinine and urine microalbumin to creatinine ratio. Even if you are a normal person without any obvious risk factors, if you are doing heavy workouts with very high protein diets, it's at least once in a year you should have a check of your kidney health. Now coming to oral nutrition supplements for kidney disease. Now kidney disease patients, they suffer from different nutritional deficiencies, like iron deficiency. The iron absorption gets impaired because of the inflamed gut in CKD patients. Patients with CKD are on multiple drugs and they might be on antacids like pantoprazole or omeprazole. That also impairs absorption of certain nutrients like vitamin B12 and certain magnesium and certain minerals deficiency can happen. Vitamin D deficiencies can happen. So it is not a blanket thing to supplement everyone with all the thing, but we in CKD patients check their iron status. If they are iron deficient, we give them oral iron supplement. If it's not working, then we go for IV supplement. For those with vitamin D deficiency, especially CKD can cause vitamin D deficiency. We check on frequent intervals, like at least once in 6 months or once in a year, vitamin D levels, and supplement if that is deficient. These are all the micronutrients. The macronutrients, the carbohydrates, the proteins, and the fat. I would say protein intake should be in moderation in CKD patients. The protein intake should not be. Sometimes people restrict their protein too much, and they land up with getting weaker, and they suffer with infections because they think that by restricting protein they can preserve kidney function. But it should not be that for preserving kidney function, you put the whole body at risk of getting infections. That should also not happen. So the ideal protein requirement for a CKD patient is 0.8 gram per kilogram. If they are taking keto analog supplements, then we can reduce that requirement from 0.8 to 0.6. That's called low protein diet. And 0.6 instead of that, sometimes we may also go to 0.4 gram per kilogram of protein intake, which is called a very low protein diet. But then there has to be a sufficient keto analog supplement. It's difficult for most of the people to eat so many of keto analog tablets, and they are expensive also. So my strategy is, unless somebody is very desperate to postpone dialysis by another year, and if they don't have any budget issues, only then I will prescribe them keto analogs. Otherwise, I tell my patients, just cut down your non-veg intake, maintain your good vegetarian protein intake. Don't cut down on your dal or rajma or chana, and have good vegetarian protein intake. You anyways can't overeat the vegetarian protein because that may cause bloating, and so restricting to a vegetarian diet would mean going on a adequately low protein diet for CKD patients.
We had one more question from YouTube viewer. Hi doctor, what's your view on blood clots because of Covishield for CKD patients?
Yeah, so yes, it is a real issue. Some people did get blood clots with Covishield, but the number is very small. Having said that, there are restrictions on COVID in certain countries where they have different options. They are restricting COVID to those above 50 years. What I would say is, if there is an option of other vaccine, females below 30 years, I would say that you can choose something other than Covishield. Or those who are above 50, I would say doesn't matter whether Covishield or any other vaccine. Go ahead, whichever is available, take it. We want to prevent a third wave. We want as many of our individuals, whether they are with CKD, who are at greater risk, they should be protected. So CKD, diabetics, all of them, it is essential that they take vaccine, whichever vaccine is locally and easily available for them. If there is a choice, then below 30 years and females below 30 years, I would prefer something other than Covishield. But if availability is an issue, don't worry. Go ahead, get the vaccine. Vaccines are more protective than harmful. Once a while somebody is getting a problem with the vaccine, the majority are getting good protection.
Thank you, doctor. We had one more question from Facebook. Doctor, how to deal with the depression and restlessness of dialysis patients at this current situation?
So this is not only in the dialysis patients, but the lockdown, the financial stress, the losing our family members, the near and dear ones, friends, business loss, all these are factors which everyone is going through in this pandemic time. And we are likely to see many people getting depressed or restless, and dialysis patients are not an exception. So many of the dialysis patients might have seen their colleagues who were coming for dialysis with them are no more after this second wave. So these are certain circumstances which may put us into circumstantial depression or anxiety and restlessness. But what I would suggest is, you need to focus. You need to focus on your health. The physical activity, exercise, like we go to gym to do exercise and build up our muscles. In the same way, our mind also needs exercise. What is the best exercise for the mind? Engaging the mind into positive thinking, which can be done with meditation. Like it may be someone may feel a religious thing, but if you are connected with the Supreme Being through meditation, like a child who has a father, he has less anxiety as compared to a child who doesn't have a father. So, connecting ourselves spiritually to our Supreme Father through the process of meditation, one who practices it every day, they are less likely to feel restlessness, they are less likely to get depressed. Meditation is the process in which our intelligence is pulling the mind away from different thoughts and bringing it back on one thought. So it is just like working against the resistance. What we do in gym, we work against resistance. So it's called resistance training because the muscles are being worked. You are working against the weight. The muscle is working against the weight, and that builds up the muscle. In the same way, when the mind, your intelligence pulls the mind away from whatever it was thinking and brings it back on the name of God or on the object of your meditation. When you are doing this, pulling the mind back, pulling the mind back, pulling the mind back, and bringing it on one thing, that is like working against the resistance of the mind, and that strengthens the intelligence. It is like a mental gym. So we need to not only do physical exercise to keep our physical body healthy, but we need to spend enough time. Sachin Tendulkar doesn't directly go into international match and perform there. He does lot of day-to-day, daily net practice, and then he can perform. So if we train our mind for this daily net practice of meditation and connection with the Supreme Being, I think that will help us whenever the circumstances change. Our mind is already trained then to hold it on a thought and not allow to get it wavered by the distractions and restlessness. So it's very important that we dedicate some time every day for this net practice of meditation. That would be helpful, I think.
Sir, we had one more question from Mr. Ravi. Sir, post-COVID recovery, we have seen there is spike in glycemic levels. So how to take care of this?
If anyone is planning for kidney transplant, then what is your suggestion? Should he go ahead? This is a different question. So COVID is a stress on the body, and whenever there is stress, that causes release of stress hormones like cortisol, adrenaline, noradrenaline, and these all are counter-regulatory hormones. Blood glucose levels. So stress is an important risk factor for causing rise in blood glucose levels. The second important thing we should know is COVID was being treated, most of the COVID hospitalized patients were being treated with steroids. That is again cortisol, our body's stress hormone. The same way the steroid, the dexamethasone or the solumedrol or the prednisolone medicines that were given to reduce the inflammation from COVID, they also cause spike in the blood glucose levels. Now, how to deal with it? We need to control the glucose levels based on how high they are. Your physician would be the right person to take decisions based on the severity of the glucose levels. But what I would suggest is reduce your grain intake, increase your vegetable intake. 70 to 80% of your meal should be vegetables and low starch vegetables. There are certain vegetables like potatoes and carrots and beetroot which will be high starch vegetables, whereas there are low starch vegetables like your bottle gourd, the rich gourd, all the beans. So vegetables, all the green leafy vegetables, all the vegetables, they have they have high fiber, low glucose. So if you change the proportion of your diet from eating more grains, like more rice and less vegetable, from that you switch to more vegetable and less rice or less roti and more vegetable, that will help in reducing the glycemic spike. Second thing is, I have personally seen the effect of de-stressing yourself. When you do Anulom Vilom Pranayam and reduce the stress in your body, you can see immediate reduction in your blood glucose levels. So do some meditation, some Anulom Vilom Pranayam. Third thing, try and do some anti-gravity exercises. Anti-gravity, that is when you are working against gravity, whether it is like during sickness, you may not be able to do much, but once you are recovering and your glucose levels are high, do at least 10 minutes of walk, at least 1.5 to 2 hours after each meal. If you spend 10 minutes doing some workout, that will reduce the spike of glucose, that is the post-meal glucose, and appropriate medication with the help of your treating physician. These should be important.
Sir, we had one more question from Mr. Madhusudan. So, doctor, can dialysis or transplant patients may take homeopathy medicine for some minor problems?
See, I'm not a homeopathic expert, so I may not be able to suggest what are the minor problems for which you may take homeopathic medications. But certainly, dialysis patients, I would say there is not much risk, but transplant patients, you need to be extra cautious because there will be different foodstuffs, different medicines which can interact with the transplant medication. So without the knowledge of your transplant or physician or your nephrologist, you should not take any unsupervised medication, whether it's Ayurvedic or homeopathic, because certain medicines from Ayurvedic or homeopathic, they improve your immune system. We have seen during COVID times, post-transplant patients taking ashwagandha to improve their immunity to fight COVID, and they have landed up with rejection of their graft because that spiked their immune system, and your anti-rejection medicines fell short of controlling that immune response. So whether it's a homeopathic or Ayurvedic medicine, every medicine has its own different role and it has different effect on your transplant medication. So for transplant patients, I would say without the knowledge of your nephrologist, you should not take any unsupervised medication.
We had one more question from Somen Rai Sarkar. Sir, please suggest for how to care of a stage 5 CKD patient.
See, once somebody has reached the CKD stage 5, it's an advanced stage. There is in near future, we are seeing the patient is going to need some form of dialysis or transplant. So our approach will be two-pronged. One, trying to postpone the dialysis, but at the same time, preparing the patient for dialysis or transplant so that the patient doesn't land up on dialysis in an emergency situation. So preventing progression is the same: good sugar control, good BP control, reducing protein leak in the urine, avoiding getting overweight, good lifestyle, quit smoking, don't take alcohol, don't take over-the-counter medication, do daily exercise, some Anulom Vilom Pranayam and meditation to de-stress the body, follow proper diet. These are the same things in nutshell to prevent progression from CKD 5 to dialysis requirement. But at the same time, it is essential that you prepare a AV fistula in the hand so that whenever dialysis is required, it becomes easier for you. You don't have to get a catheter done to start dialysis. So early the fistula, the good the results, the fistula quality will be good. Second thing, prepare yourself with vaccination against hepatitis B, against pneumonia and influenza. So these three types of vaccines should be given to all CKD patients. The earlier the vaccines are given, the better, because the immune response to these vaccines will be better at the earlier stages. If not, at least in stage 5, before landing on dialysis, these vaccinations should be completed. So choosing the right dialysis modality, whether CAPD versus hemodialysis versus transplant, these discussions should happen with the nephrologist so that you are mentally prepared in future what mode you are going to choose and prepare according to that. So person, it is rightly said that the soldiers who sweat more during the peace will bleed less during the war. So those who have prepared themselves for future requirement of dialysis properly, they will suffer less when they land upon dialysis. Those who have not prepared and landed in an emergency situation, they will have more suffering. So these preparations need to be taken care of during the CKD stage 5.
Thank you, Doctor. Third wave is we are expecting in next couple of months' time. So, what is your opinion and take-home message for the audience, viewers?
The opinion is divided whether there will be a third wave or it will be a staggering up and down the peaks and troughs coming over a longer time. So no one knows. It's a speculation, but there is some heartening news that 70% of our Indian population is already having antibodies. So many people are now daily getting vaccinated. So our hope and wish is that there won't be a third wave. It would mostly be like some cases coming up and down, going through the next one full year. There will be some cases going up and down. That is what I feel. Having said that, it's still important that we follow all the social distancing norms, the precautions, the hand sanitization, and taking, especially if somebody is having respiratory infection symptoms, maintaining a proper distance and taking all the precautions to prevent the spread. I would say all these precautions should be taken, and vaccination is very important. Everybody should go ahead, take the vaccine so that we all are protected and we can prevent this third wave from coming.
Thank you, Doctor. Thanks for your time and your valuable suggestions for the